Hi, guys. Welcome back for our daily practice question. It is day 8 of our series, but y'all know I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number 1 for today. And just a quick note, my 5-week intensive review, the first one for this year, starts next week on Monday, January the 13th. I know some of you have reached out to me. I have 2 spaces remaining. Make sure if you are trying to be in that class to get in before it is filled. Once it's the last 2 slots are booked, registration closes. And I like to keep it as smaller classes because in the last week of the 5-week review, I work with each of you individually, just to talk about your progress, talk about exam readiness, and provide you with tips once you finish the class. So I don't like to make the class too large. So if you are looking to get it, make sure you are clicking that link to get that registration. I'll add it in the description as well if you still need it. All right, back to our questions. Question number 1. The nurse practitioner and NP student are discussing Snellen chart results. The NP student inquires about the use of the Snellen chart. What is the primary purpose of the Snellen chart in clinical practice? Is it A, to measure intraocular pressure, B, to assess visual acuity, C, to determine the presence of color blindness, or D, to evaluate the health of the retina? Take a moment and tell me what you got in the comments, you guys. Tell me what you got. Tell me what you got. All right. So y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, what is the primary purpose of the Snellen chart in clinical practice, right? So this is one of those examples of how the stem of this question tells you exactly what you need to be answering, right? You don't need anything else. So why do we use the Snellen chart? And the best answer is B, right? To assess visual acuity, right? Question number 2. A 60-year-old patient completes a Snellen chart test and the results are 20/80 in both eyes. Which of the following is the most likely interpretation of this result? Is it A, the patient can see at 20 feet what a person with normal vision can see at 80 feet? Is it B, the patient has normal vision and does not need corrective lenses? Is it C, the patient can see at 80 feet what a person with normal vision can see at 20 feet? Or is it D, the patient has legal blindness? Take a moment and tell what you got. All right, all right, all right. Stem of the question states, which of the following is the most likely interpretation of this result? All right, so what result do we have? So we have the 60-year-old patient that comes in, right? Had a Snellen chart completed, and the results are 20/80 in both eyes. So what does this mean? And your best answer is A. This means the patient can see at 20 feet what a person with normal vision can see at 80 feet. I always tell you guys, so when you're stuck in these scenarios, and I shouldn't say stuck, but whenever you are in these scenarios with Snellen charts, I know we can flip them. I know we understand vision. I know y'all probably looked at that number and like, I know that's abnormal, but I need you to understand it. And the easiest way that I always tell you guys is the top number will always be 20. So it's always the patient can see at 20 feet because they're always at 20 feet. We make the line away from the Snellen chart. The line is always that tape on the floor, the X on the floor that you see in the doctor's offices and what am I trying to say? Like when you go to the eye doctor. Girl, why can't I think of the name? Jesus, it's too early. Listen, when you are away from the chart, those lines are marked 20 feet away from the Snellen chart. Optometrist, that's what I'm trying to say. Y'all, I wasn't, my personality was not going to let me let that go until I said the correct term. But anyway, to tie that all up, because in true Brittany fashion, I just went on a sidebar rant. But on the Snellen chart, it's always hanging in one spot in these practices. So either in your primary care office, when you go to the eye doctor to see the optometrist, it's hanging on the wall, and there's always a line or an X, typically made out of tape, because that is marking the 20 feet away. So the patient will always be 20 feet. So the top number is 20 feet, and that stands for the patient, right? The patient can see at 20 feet. And then the denominator is what someone who has 20/20 vision with normal vision would see. So it's basically saying where you're standing as the patient at 20 feet, you can see what somebody with normal vision would be able to read 80 feet away. Okay? So A is your best answer. All right, y'all. And lastly, question number 3. A 35-year-old patient reports no visual complaints but completes a Snellen chart test during a routine physical exam. The result is 20/25 in the right eye and 20/20 in the left eye. How would you interpret these results? Is it A, the patient has normal vision in both eyes and no further action is necessary? Is it B, the patient has moderate visual impairment and requires corrective lenses? Is it C, the patient has a serious eye condition that requires immediate intervention? Or D, the patient is legally blind in both eyes? Take a moment and say what you got. Tell me what you got. All right, so stem of the question here states, how would you interpret these results? All right, so what do we have here? So we have a 35-year-old patient that reports no visual complaints. They're just here for a routine physical, Snellen exam done. Results 20/25 in the right eye and 20/20 in the left. Y'all, the best answer is A. This is a normal vision. 20/25, I know, is not specific at 20/20, but it's still in such a close range of normal. So 20/20, is completely normal, but no further action is necessary at this time. So A is your best answer. Y'all, if y'all struggle with Snellen charts, I do have a short that I kind of go through when I talk about this. Hopefully this explanation was helpful to y'all, even including my rants. But as always, y'all be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, as always, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursinstudio1@gmail.com. All of the things that I do offer are linked in the bio of this channel, including my website. I always say, if you're looking to book any one-on-one sessions with me or any of my custom plans and packages, I always say either call, text, or email so that I can speak with you to gauge what you truly need to make sure you're booking the appropriate session type, okay? And then, again, like I mentioned at the beginning of this video, I have 2 remaining spots for the upcoming 5-week intensive review. It's for family and adult gero. It is starting on Monday. 5 weeks, we work through all of the material. Monday through Friday, you are provided with assignments and videos that teach you on the content, and there are many assignments for you to complete to aid in your studying. You are able to do that at your own pace and submit them whenever your availability is that day. Some people choose to prefer to do it like, hey, I want to get all of this done in one day, or some people do it each day. Whatever works for your schedule is best. Whatever is best for you is fine. And then we do weekly group practice questions live. And once registration is closed, I always send out an email to determine what is the best day weekly for the majority of the group. And if you're unable to make the lives, it's fine. I always save the replay so that you're able to watch it. And even if you do make the live and just want to listen to it over and over again, it's always accessible. And then, like I said, the last week, the reason that I keep the classes small is because that final week is for individualized um, session. So you get a call with me so that I can talk about your progress from your assignments, talk about my exam readiness assessment on where you are, and give you any tips and advice for proceeding before boards. So if you're looking to grab one of those 2 slides, make sure you click the link in the description. And I would love to work with you. Hope to see y'all there. But as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.